That was a great welcome. As the lifelong Iowan in the group, I just want to welcome Josh and Joanne to our wonderful state, and that they understand that we are the best state in the whole union, so I really appreciate that. It's great to hear that, and I actually think that, but I am a little biased being from here, so it's nice to hear it from other people. What I'd like to talk about today is sort of how we got to healthcare reform, at least some of the trends that led us to healthcare reform, what we have with healthcare reform, and then really didn't know what Josh's last slide was going to be, but I think I agree with Mr. Churchill that what things we need to continue to keep sort of feet to the fire as far as what we need to continue to reform. This is not the end, this is the beginning. And I worry that sometimes when you have this large a legislation, which honestly, I don't think I ever thought I'd be standing here talking about a bill that got passed. Sometimes I can't believe it did. So it's great that we're here, but we have to think about this as the first step in many steps. So anyhow, to sort of start talking about that, I always have to start with the statistics. The statistics are just unbelievable, that 3 out of every 4 healthcare dollars are spent on treating chronic disease. Think about that. I mean, that's where the money is, that's where we go. Costs over $1 trillion annually for the health insurance companies, employers, federal government, state government, me, you. We're all paying for this. And so we need to find a way, and that really was one of the reasons we had healthcare reform boil to the top, was because of those rising costs. Something has to be done to combat the rising costs of preventing, treating, and curing diseases such as diabetes and heart disease, epilepsy, and Alzheimer's. With healthcare reform poised to be a major campaign issue back in 2007, or 2008 and 2007, we started to have a conversation about what could we do. To Josh and Joanne, maybe you don't know, but we are the center of politics when it comes to a presidential election, and this election was no different. Certainly with no incumbent, we had a gaggle of people here, and we had an opportunity from a grassroots level to really influence what was going to happen with healthcare reform. So in 2007, the Partnerships of Better Health was born, and I'm one of the co-chairs with Chris Atchison. The goal of Partnerships for Better Health was to create a network of organizations, businesses, and healthcare associations to address the need for a new strategy to influence politicians on that rising cost of healthcare. The timing was perfect to take advantage of those unique presidential candidates that come to our caucuses, and we had a gaggle of them, from Hillary Clinton, one of my favorites, to Ron Paul, and every one of them we made sure that we got influenced and conversation going with talking about healthcare reform. And our message was really simple, and I really like this message, and I repeat it because I think it has a lot to do with where we're going in Iowa and in the nation, and that's we need to invest in health to save on health care. So think about that. It addresses the rising costs, but it's really about putting down the money first so that we can save the money later and save in all the costs of health. So we realize that patients often cannot have access or do not receive the care that they need to stay healthy. That's that prevention. This was nowhere more apparent than in the prevention and treatment of chronic disease. The trillions of dollars are spent on treating chronic disease, and when we looked at the healthcare delivery and reimbursement system, we saw significant barriers that needed to be addressed to make widespread improvement to reduce both the human and financial costs. Human and financial, remember those people. I'm a doctor, I have to remember the people, and that are inherent in the system. So it was no secret we needed a healthcare system that was reliable, proactive, efficient, and engages patients in a way that ensures the best outcomes. I think that's what we all wanted. It's getting there that's the problem. So the only way to achieve that is to ensure that you have comprehensive healthcare reform that included 3 things we like to talk about: prevention, intervention, and innovation. And that's what we call the triple solution. So really on September 23rd, one of those is going to start, which is we'll have prevention as first dollar. The First Lady was talking about it yesterday. That's a major step in the right direction that happens very fast. So prevention. To effectively lower costs through prevention, incentives in the healthcare system must focus on keeping people well rather than treating people after they become sick. We've gotten used to this, even though when I was studying in medicine, we really didn't talk about wellness nearly like we do today. It really is a change that has happened in this country. As Senator Harkin states, and I love to always quote Senator Harkin, we have a sick care system instead of a health care system. 7 out of 10 deaths are the direct result of those chronic diseases in the United States. Many of these deaths are unnecessary results of the unhealthy lifestyle habits, poor diet, lack of exercise, tobacco use, and prevention calls for the creation of strong incentives and enhanced patient education for preventive health and wellness efforts to improve quality of care and to better manage our healthcare costs. Now, this includes placing an emphasis on closer provider relationships, which when we were talking about the people being readmitted after being discharged from the hospital without ever seeing a physician, obviously that's a closer physician relationship is needed. So emphasis on those closer physician relationships, periodic wellness checkups, and adherence to appropriate vaccination programs. Never ceases to amaze me how our vaccination programs do not, you would just think it would be at 100%. I talk to lay people all the time who can't believe that everyone's not vaccinated. So really have to show people how this is now a first dollar benefit and needs to be utilized. Secondly, we talk about intervention, and even with increased prevention efforts, people will still become sick. I'm a doctor, I'm not going to go out of business. So intervention ensures that when they do, the patient receives and adheres, and that's very important, to appropriate treatment to minimize the potential for more costly complications down the road, thus lowering healthcare costs. Another quote of Senator Harkin's is that we'll pay for amputating a diabetic's foot, but we will not pay for nutrition counseling for that same diabetic so he doesn't have to have the foot amputated. We do have an upside-down system in incentives and need to really readdress that. So Partnerships for Better Health strives to create an environment that helps people get the right treatment at the right time to maintain their health. And lastly, I'd like to talk about innovation, because this is the one I think we need to talk about as the next more reform. It really wasn't hit as hard in this newer, this first step of healthcare reform. Chronic diseases can be managed more effectively with intervention, better treatment, and still need to meet the needs of the patients with disease that have very few, if any, effective prevention measures or treatment alternatives. And there are a lot of diseases like that. One example is Alzheimer's disease, which is a costly and devastating unmet medical need. Today, Alzheimer's costs more than $140 billion a year, and as the society ages, the incidence of Alzheimer's is expected to triple or quadruple over the next 30, 40 years, really being especially sensitive in our state because of our aging population and our older population. While there are several drugs on the market designed to treat the symptoms of the disease, available treatments are limited and no effective prevention measures currently exist. Certainly they're trying, but they're not there yet. So according to the Alzheimer's Association, delaying the onset of Alzheimer's disease by just 5 years could cut the number of people developing Alzheimer's in half. Both the public and the private sector must be encouraged to invest in ongoing research to reduce the human and financial costs of America's most devastating chronic disease. So with this ammunition, the Partnerships for Better Health is dispatched across the state with our partners and a crew of local opinion leaders to engage presidential candidates back in 2008 and ask them to incorporate the triple solution into their healthcare policy agenda. We actually had more success than, again, maybe I'm usually an optimist, but maybe I'm not as optimistic as I think, because I didn't think we'd have healthcare reform, and I didn't think we'd do as well as we did, so maybe I'm not as much as I think. But ultimately, with the election of President Obama, the triple solution, many points of it were incorporated into the healthcare agenda in 2009 of the Patient Protection and Affordability Care Act. So we really felt like we had a great influence on what we needed out of healthcare reform, that comprehensive healthcare reform. Just to highlight a few, in the area of prevention, the legislation provides billions for the Prevention and Public Health Investment Fund, places a large emphasis on wellness programs such as menu nutrition labeling at chain restaurants, workplace wellness programs, and web-based prevention tools is one of my favorites, which helps individuals create a personalized prevention plan, because we have to get people engaged in their own health. It can't be something their doctors or healthcare people do. It has to be something they're engaged in. I think we all know that. According to the Trust for America's Health, an investment of $10 per person per year in proven community-based prevention programs could save up to $16 billion annually in 5 years, or return about 5.5 times our initial investment. So these investments in prevention are really an exciting step forward. On the intervention side, the bill provides access to millions who are uninsured, as Josh was talking, are underinsured. This access alone that they haven't had, and so they're not getting their standard, their quality care, especially for their chronic disease. They're going in when they're sick and going to the ERs. This alone enables individuals to effectively manage their conditions and saves billions in future costs. The reform package also implements several other intervening concepts, such as the medical home concept that we're going to talk about later, increases health information technology, which really will help with those getting standard of care, not just getting a random course of care, but getting the best possible care for the chronic disease. And also there's the medication therapy management pilot program. I know one of our panelists is probably interested in. And there's a lot of these programs that really help try to get the best care for chronic disease. Finally, we get to innovation, and where the legislation seeks to add additional resources to the National Institutes of Health and provides resources for the translational research, which of course we're doing a lot here, and it creates a center for Medicare and Medicaid innovation, which is supposed to be established in 2011, will receive $15 billion over the next 10 years. It also creates the Cures Acceleration Network. So it's not without its innovation. And it provides new funding mechanisms for the NIH through which you can contract to be awarded to accelerate the development of high needed cures, such as the Alzheimer's. But I really want to stop and think about, we've made great progress, but we need to include more addressing prevention and innovation, intervention, but mostly with innovation. So if we increase funding and establish alternative resources to the National Institutes for Health, it's a key part of the healthcare puzzle. It cannot be the only approach to innovation. Nowhere in the legislation is there a discussion of public and private partnerships to create new and innovative treatments and cures for chronic disease. Maybe it's because of my work on the Iowa Department of Economic Development, but I always talk about jobs are everywhere, and this is really about jobs. It doesn't foster an environment where pharmaceutical and medical technology companies are encouraged to develop new technologies. So we need to help Washington to encourage a public and private investment in medical research and development to create new treatments and cures to chronic disease. There's so much that can be done administratively, legislatively, and fiscally to break down the barriers that research facilities, medical innovators, and ultimately the patient faces to getting this medical research to the patient level. Prevention and intervention can only go so far to reduce the cost and help the suffering from illness. There are numerous chronic conditions that only benefit from innovative treatments and cures, such as cystic fibrosis, epilepsy, Lou Gehrig's disease. The need for innovation is essential. Those people don't want to hear about prevention. They don't want to hear about intervention. They want to hear about a cure. Currently, intervention is allowing lupus sufferers to see the release of a new treatment for their condition. There hasn't been a new treatment for lupus in 50 years. I won't tell you how old I am, but I was kind of around barely when that was happening. So, Eisenhower was president. So it's been a while since there's been any new treatments for lupus. This is the kind of innovation we need to foster. And we need to, we're talking about an HIV vaccine. There are so many things we can talk about with innovation, and we need to just keep the pedal down on this. Not only is there a human interest in intervention, but a financial one as well. Cancer is a perfect example. National estimates indicate that with a mere 1% reduction in cancer mortality rates could translate to $50 billion in healthcare savings. A cure could mean God knows what, but 50 trillion is what they talk about. The time for cancer innovation was 15 years ago, really. And although cancer screenings and treatments have come a long way, just think of where we could be if we could be curing some of these diseases. Physicians and patients continually look to medical technology for the newest treatments when current cures are failing. Unfortunately, the need for innovation only reaches the everyday citizen when it personally affects them. When mom develops Alzheimer's disease or your husband is diagnosed with diabetes, this is why the Partnership for Better Health is continuing to push our policymakers and public opinion towards the need for innovation. We'll keep working on healthcare reform and make sure it's implemented and future revisions occur to ensure that we move forward and innovation does not get left out of the picture. In early June, the Councils for America's Medical Innovation released the Battelle Medical Innovation Policy Agenda, which is entitled Gone Tomorrow, a call to promote medical innovation, create jobs, and find cures in America. The study was conducted to provide needed information regarding a growing concern that U.S. technologies in medical innovation was waning. The group asserts that a resurgence in healthcare research and development will assist our recovering economy and help individuals suffering from chronic disease. Certainly two things that are sort of coming together at this time in our nation. The report identifies key issues and needed policy changes that affect medical innovation. Some of the key issues derived from the agenda include calling on the Obama administration to designate a federal-level office to be a leader in addressing the challenges regarding the need for medical innovation, forming unique public-private partnerships to develop innovative technologies, strengthening investment in research and development and manufacturing to foster job growth and enhance U.S. competitiveness, enhance regulatory sciences efforts at the Food and Drug Administration, and increasing the U.S. bioscience talent pool, something I've been sort of involved in myself. This report speaks to the core of the Partnerships for Better Health's innovation message, and it is important to note that other organizations across the nation are seeing the need to invest in health to save on health care. There's that thought again. This report also shows the lagging effect that the lack of medical innovation can bring to our nation's finances and health. The Partnerships for Better Health will be utilizing this and other resources as we discuss the innovation message with policymakers, the media, and other advocates to ensure that innovation is not left out in future efforts to reform healthcare. We're driving the need for innovation by engaging our 35 plus, and a lot of them are in the audience today, partner organizations and local opinion leaders to address our congressional delegations and the media, reminding them that prevention, intervention, and innovation are the three-legged stool of healthcare reform. And as any Iowan knows, and I'll just tell Joanne and Josh, if the stool doesn't have three legs, it falls over. So that's why it's important. We must have prevention, intervention, and innovation to reduce the human and financial burdens of chronic disease on our healthcare system. I would like to put a little plug in. If you're not currently a partner or an advocate with Partnerships for Better Health, we support. There are some brochures and partnership forms on your table. We also encourage you to become a friend on Facebook, which my kids have turned me on to, so I can actually do Facebook now. And you can become a friend on Twitter, but I haven't gotten that far yet, so I won't see you there. And you know, the reason we do the Facebook and the Twitter is because, as you all know, in the policy world, things happen pretty quickly. And so we want to make sure everybody can stay up to date on what's going on. So just to sort of summarize, we've come a long way in healthcare reform. As I said, I didn't think I'd be standing here. But it's wonderful, you know, and the other thing, I want to compliment Chris. I cannot believe on a beautiful July day in the middle of summer, you got this many people to talk about healthcare reform. So I'm very impressed. But I mean, really, it's wonderful. But I invite each of you to individually, as well as the organizations you represent, to join us in this initiative. Without addressing innovation, we will not improve the health of Iowans and all Americans in the way we expect this legislation to do. So ensuring that we have policy environments that encourage and reward innovation in both the public and the private sectors are essential. We must continue to have an investment in medical research that will result in better treatments to prevent and lessen the toll of chronic disease. Once again, thank you for all your work and continued efforts to promote healthcare and prevention, intervention, and innovation. Investing in health to save on healthcare is the only way to change our healthcare delivery system and reduce the toll of chronic disease while minimizing the cost. I look forward to discussing it further with you. Thank you.